As we move into a phase of having operative schedules opened up to elective surgical cases but still lack ideal access to highly sensitive COVID testing, we believe it is appropriate to take steps to reduce risk to the surgical team. We would like to share a tenting, draping, and scavenging strategy that we worked on in the simulation lab that would be used for appropriate transoral procedures.
Good. All right. So this is what we come up with for tonsillectomy, adenoidectomy, kind of simple oral cavity procedures where the surgeon is standing at the front of the bed here. So what we've got here is a couple of ether drape arms here. Got one here, one here. They're staggered in height just a little bit. This is a fluid warmer drape, and again, we'll put a picture of the drape itself or the packaging so you know exactly what we're dealing with, okay? We've got a Boston arm and a Crodavis mouth gag in. We've got a couple instruments in the mouth there that you can see. So what we're trying to do is we're trying to isolate this surgical environment here because again, this is a high-risk procedure. It's in the oral cavity, and we want to protect everybody in the operating room the best that we can. So with this fluid warmer drape, we cut a couple of cruciate holes here for the surgeon to get the hands into. This drape itself is fairly transparent, but we can do better. So we cut a little hole here, and then we took the shield off of a face mask and taped it right here because this is even more transparent. And as long as it's not facing right back at you, you won't get the glare of your own headlight back at you. So, and then on here, we put a little flapper valve here so that when your hands are not in the surgical field, you've got an extra drape here closing up those little holes. So you can see that we can get our hands into the surgical environment. We can do our surgery. We actually have some ability to get from one side to another because this drape is flexible, okay? And so this should be good access to be able to do oral cavity procedures. And then the other drape that we'll show you is another drape that will go down onto the surgical environment. And then the other thing is that we will put tubing, a scavenger tubing that goes to the Neptune. That tubing will come right up here, and we'll have it taped right up into the surgical environment here. So we've got a high flow scavenger sort of a strategy going on at the same time.
This is the first drape that was demonstrated that lays up over the top of the ether drape arms. This is the second drape that goes on. This one has some adhesive on it, and we will demonstrate how it goes on next. Next, we will go over how we plan to use a smoke evacuator to help clear some of the effluent that might come out of the oral cavity. This is the Neptune suction unit that we have in our operating rooms. We will go over how we will use the smoke evacuator port for the purpose of using it as a scavenger. It is important to note that the smoke evacuator tubing goes straight into the ULPA filter, and there's no canister here to capture any fluids. This is the removable ULPA filter, which is on the side of the Neptune unit. This type of filter is even more efficient than a HEPA filter.
The second time, the smoke is definitely the second.
We hope that you found this brief demonstration video useful to show steps that can be taken to isolate the surgical environment for the purpose of reducing risk to the entire surgical team. We believe that the concepts of tenting, draping, and scavenging can be useful to achieve this goal.